witness is Marilyn Cawthon from the Pennsylvania Association of Staff Nurses and Allied Professionals. Ms. Cawthon.
Good afternoon. My name is Marilyn Cawthon. I've been privileged to be a registered nurse for over 36 years. I spent most of my career in critical care. I've always felt that my first duty as a nurse was to be an advocate for my patients' needs. I've come to realize this is not just a responsibility during their hospital stay anymore, but an everyday commitment for all patients. That's why I'm here today. My father died at 48 from heart disease. It's part of the reason I went into nursing. In August of 2000, I told my doctor I was experiencing shortness of breath with exercise, and he scheduled me for a stress test. It was positive. I needed to have a cardiac catheterization to check the valves and arteries in my heart. A lot of thoughts went through my mind when I first heard this. I was scared. I didn't want to die. I wanted to be there for my 13 and 15-year-olds, see them grow up. I wanted to be there for my two older daughters. First one was having my first grandchild. But I put my affairs in order and scheduled the catheterization for January 1st. As the time neared the procedure, I knew I wanted more time with my family. I'd been working 12-hour days, 5 days a week. I decided to become a contract nurse and work 40 hours a week. I was going initially to cover my benefits, but I was also looking into outside health plans. A few weeks before the catheterization, I spoke with Independence Blue Cross about their individual family plans. Under this plan, I would save $100 a month. I explained to Blue Cross that I had procedures scheduled in a few weeks. I said I did not want any question about coverage, because I could still COBRA. I was told there would be no problem. The procedure would be covered, as there would be no gap in coverage. I asked for it in writing, no problem. On the day before the procedure, I received a form letter from Independence Blue Cross. Requested service has been approved.
On January 3rd, I had the cardiac catheterization. A blockage was found, ballooned open, and a stent was placed. I was back at work 3 days later and very grateful. I know they prevented my having a heart attack. 3 weeks later, I received a form letter from the hospital where I was treated stating that Blue Cross denied benefits due to a pre-existing condition. I immediately called Blue Cross. I was assured this was a mistake, that they were in the process of making payment and not to worry. 9 months later, I received an official denial of services letter from Blue Cross due to a pre-existing condition. I immediately called Blue Cross and sent certified letters of appeal. This was the beginning of many calls and certified letters. On the phone, I was always told that a mistake had been made and would be looked into, to call back in a week and it would be corrected. I was always given the same line week after week and month after month. My certified letters were all ignored. I was stuck with a $4,471 hospital bill that had already been turned over to a collection agency, and my credit was ruined. I paid 16.5% on my car loan interest and 13.5% on my daughter's student loans. The fallout from this continued. On November 20th, 2004, there was an article in the Philadelphia Inquirer about G. Fred DeBona, President and CEO of Independence Blue Cross. It was about his fight with cancer. I wrote him that day and hoped that he would win his battle against cancer. I also told him what his company had done for me. Excuse me. I received a letter from Independence Blue Cross. A decision has been made to have the claim reprocessed for payment. This is a one-time exception. I was relieved and grateful that the hospital and the professionals who had helped me were reimbursed, but the chain of events this insurance mess caused in my life could not be compensated. I don't want anyone else to go through this. During those 4 years, I began reading about and investigating healthcare reform. A single-payer system would offer the most comprehensive health care. It would save money. It would save lives. I've been a registered Republican all my life. I don't see this problem in terms of politics, but in terms of what kind of health care system would help others avoid the struggle I endured. Under single-payer, I would have been able to go to my own private doctor and hospital, and my life and finances would not have been turned upside down by a private insurance company. As a registered nurse, I see people every day who delayed care because they were uninsured or underinsured, only to seek help when it's catastrophic or too late. I see insurance companies dictating decisions over doctors on what medications a patient can take, what procedures they can or cannot have, and how long they can stay in the hospital. I'm old enough to remember when the patient was the bottom line, not profits. As a healthcare professional, I deal with people at their most vulnerable, people who are sick, dying, and in pain. Their most basic thoughts aren't about the trillions going to banks on Wall Street or the wars in Iraq or Afghanistan. They want to be taken care of now. They deserve to be given the best care available. They can get this care now if we pass House Bill 676. We need to take steps now to solve the healthcare crisis in America.